Thank you, Mr. Speaker. Last Friday, the Health Secretary said that right from the start, we've tried to throw a protective ring around our care homes. That caused quite a reaction. Yesterday, it was flatly contradicted by the Chief Executive of Care England. He was giving evidence to the Health Select Committee, and he said we should have been focusing on care homes from the start. Despite that, this is his evidence, despite what is being said, there were cases of people who either didn't have a COVID status or were symptomatic who were discharged into our care homes. The government advice from the 2nd to the 15th of April was that, and I quote, negative tests are not required prior to transfers or admissions into care homes. What's protective about that?
Prime Minister.
Mr. Speaker, as he knows full well, of course he's right to draw attention to what has happened in our care homes, and we mourn the loss of every victim, but no one was discharged into a care home this year without the express authorization of a clinician, and as I pointed out to him, who have the interests of those patients at heart. And as I said to him last week, which he doesn't seem to have remembered, actually the number of patients discharged from hospitals into care homes was 40% down in March on January. The guidance was changed to reflect the change in the epidemic, and that guidance was made available to care homes. And of course, since the Care Homes Action Plan began, we have seen a sharp reduction in the numbers of deaths in care homes, Mr. Speaker. And indeed, since I last stood before this House, the number of deaths in care homes has come down by 31%. And I think he should pay tribute to all those who have helped to fight that epidemic across the NHS and across our local services.
Keir Starmer.
Mr. Speaker, I think the Prime Minister rather missed the point. The question was whether people were tested going back into care homes. And the Chief Executive of Care England says because they weren't, people who had no COVID-19 status or who were symptomatic were discharged into care homes. That's a very serious issue that requires an answer. Yesterday, the Chief Executive of Care England, in his evidence, was also asked when routine testing would start in care homes. This is the answer he gave yesterday. I think the short answer is that we've had the announcement, but what we haven't had is delivery. And we are not really clear when that will arrive. This is the Chief Executive of Care England in his evidence. Even the government's command paper, published last week and introduced by the Prime Minister to this House, says within it, the command paper, I'm quoting now, the Health Secretary says he's wrong, quoting the government's paper, every care home for the over 65s will have been offered testing for residents and staff by the 6th of June. That's from the Prime Minister's command paper. That's over 2 weeks away. What's causing the continued delay in routine testing in our care homes?
Prime Minister.
Mr. Speaker, I'm afraid he's simply in ignorance of the facts, because the reality is that already 125,000 care home staff have been tested, 118,000, perhaps he didn't know that, Mr. Speaker, 118,000 care home workers have been tested, and we are absolutely confident that we will be able to increase our testing, not just in care homes, but across the whole of the community. And thanks to the hard work of my right honourable friend and his teams, we will get up to 200,000 tests in this country by the end of this month. And he may know, perhaps it's one of those statistics, international comparisons he hesitates to make, but actually this country is now testing more than virtually any other country in Europe.
Keir Starmer.
Mr. Speaker, again, the question was when routine testing would start, and the Chief Executive of Care England, who knows what he's talking about, gave evidence yesterday that it hasn't. If the Prime Minister is disputing the evidence of the Select Committee, that's his own business.
Order. Secretary of State for Health, please. I don't mind advising the Prime Minister, but you don't need to advise the opposition during this. Sorry, do you want to leave the chamber on maximum numbers? If you want to give way to somebody else, I'm more than happy. Keir Starmer.
Mr. Speaker, and to assure the Prime Minister, I'm not expressing my own view. I'm putting to him the evidence of experts to committees yesterday. Testing, as referred to by the Prime Minister, that on its own is obviously not enough. What's needing is testing, tracing and isolation. At yesterday's press conference, the Deputy Chief Scientific Advisor said that we could draw particular lessons from Germany and South Korea, which have both had intensive testing and tracing. The number of COVID-19 deaths in Germany stands at around 8,000. In South Korea, it's under 300. In contrast, in the United Kingdom, despite 2 million tests having been carried out, there's been no effective tracing in place since March the 12th, when tracing was abandoned. That's nearly 10 weeks in a critical period without effective tracing. That's a huge hole in our defences. Isn't it, Prime Minister?
Minister.
Mr. Speaker, I must say that I find it peculiar because I've given the Right Honourable Gentleman repeated briefings on this matter and many others. He's perfectly aware of the situation in the UK as regards testing and tracing in early March. It's been explained many times to him and to us. But what I can tell him, and I think his sort of feigned ignorance really doesn't come very well, but what I can tell him is that today I am confident that we will have a test and trace operation that will enable us, if all the other conditions are satisfied, and it is entirely provisional, that will enable us to make progress. And I can tell him also that by the 1st of June, already we've recruited 24,000 trackers, and by the 1st of June we will have 25,000. They will be capable of tracking the contacts of 10,000 new cases a day. And to understand the importance of that statistic, I should just remind him that today the new cases stand at 2,400. So we're making vast progress in testing and tracing, and I have great confidence that by June the 1st we will have a system that will enable us, will help us very greatly to defeat this disease and move the country forward. And I hope therefore that he will abandon his slightly negative tone and support it.
Keir Starmer.
34,000 deaths isn't negative. It's negative. Of course I'm going to ask about that. And quite right too. The Prime Minister knows, he says feigned ignorance. For 10 weeks there's been no tracing, unlike Germany and South Korea. And tracing is critical. There's no getting away from that. There's no getting away from it. The Prime Minister knows it's absolutely vital. He made a great deal of it in his speech to the nation Sunday week ago. He said we cannot move forward unless we satisfy the test that he's set, one of which is test, a world-beating test and trace system. World-beating. Leaving aside the rhetoric, effective will do, there now appears to be some doubt as to when this is actually going to be ready. This is the last PMQs for 2 weeks. Can the Prime Minister indicate that an effective test, trace and isolate system will be in place by the 1st of June, Monday week?
Prime Minister.
The Right Honourable Gentleman seems to be in the unhappy position of having rehearsed his third or fourth question without having listened to my previous answer. I've a brilliant forensic mind that he does. What he has heard is that we have a growing confidence that we will have a test, track and trace operation that will be world-beating, and yes, it will be in place. It will be in place by June the 1st. And just to repeat the figure, since he's invited me to do so, there will be 25,000 trackers. They will be able to cope with 10,000 new cases a day. And that's very, very important because currently new cases are running at about 2,500 a day. They'll be able to trace the contacts of those new cases and to stop the disease spreading. And what I hope very much is that, notwithstanding the occasional difficulty of these exchanges, and I totally appreciate the role that he has to fulfill, that he will support us as we go forward, that he will be positive about this test, track and trace operation, and that we can work together to use it to take our country forward, because that is what I think the people of this country want to see.
Keir Starmer.
I'm very happy to work with the Prime Minister on that. He knows that from our previous exchanges. Mr. Speaker, every Thursday we go out and clap for our carers. Many of them are risking their lives for the sakes of all of us. Does the Prime Minister think that it's right that care workers coming from abroad and working on our front line should have to pay a surcharge of hundreds, sometimes thousands of pounds to use the NHS themselves?
Prime Minister.
Well, Mr. Speaker, I thought a great deal about this, and I do accept and I do understand the difficulties faced by our amazing NHS staff, and like him, I've been a personal beneficiary of people who've come from, carers who've come from abroad and frankly saved my life. So I know exactly the importance of what he says. But on the other hand, we must look at the realities that this is a great national service, it's a national institution, it needs funding, and those contributions actually help us to raise about £900 million, and it's very difficult in the current circumstances to find alternative sources. So with great respect to the point that he makes, I do think that that is the right way forward.
Keir Starmer.
Mr. Speaker, I'm disappointed because the Prime Minister just knows how raw this is. The fee in question, the immigration health surcharge, is currently £400 a year. From October, that goes up to £624 a year. For a care worker on the national living wage, that will require working for 70 hours to pay off the fee. The Doctors Association, a number of medical groups, wrote to the Home Secretary this week, and they set it out this way. At a time when we're mourning colleagues, your steadfast refusal to reconsider the deeply unfair immigration health surcharge is a gross insult to all of us who are serving this country at its time of greatest need. We agree, and Labour will table an amendment to the immigration bill to exempt NHS and care workers from this charge. Can I urge the Prime Minister to reconsider his view as we go through this crisis?
Prime Minister.
Mr. Speaker, I've given my answer, but what I will say is that I think that it is important that we support our NHS and that we invest massively in our NHS, and this government, this One Nation government, Conservative government, is determined to invest more in our NHS at any time in modern memory. We've already begun that, and we will want to see our fantastic frontline workers paid properly, and that is, I think, the best way forward. I want to see our NHS staff paid properly, our NHS supported, and I want to continue our programme, not just of building 40 more hospitals, but recruiting 50,000 more nurses and investing hugely in our NHS. And I believe that will be warmly welcomed across the whole of our establishment of our fantastic NHS.
We're going to lovely Lancashire with Sarah Brickliffe.
We will make America great again.